Dr. Raghav, it's
Yes,
great
good.
to meet you today at this session and for scoring and securing a topmost rank in NESS teams, rank number 3 in MCH Surgical Oncology. From the entire fraternity of faculty from SPEED, I bring in all the greetings and wishes to you.
Thank you, sir. Thank you very much.
So, can we know about some background aspect of Dr. Raghav, from where he comes from and where he did his medicine and MS from?
Sir, I have done my MBBS from Andhra Medical College, Visakhapatnam, from 2012 to 2018. I have done my MS from RML Hospital, Delhi, from 2018 to 21. I'm presently preparing for oncology, sir, surgical oncology.
And why surgical oncology? What inspired to choose that specialty? Any specific reasons?
Sir, in our country, especially the care of oncology patients is very poor. In this present decade, there is a cancers. I feel the pandemic of oncology cases have presently started, but still we have the facilities and the entire medical fraternity is not prepared for it. Actually, and there is also scope for a lot of research in this field. This has made me think and choose my career as surgical oncology, and just to increase the hope of the patients and to increase their living.
Something about your preparation strategy. When did you start your preparation? How many hours you prepared per day? What's your revision strategy?
So my preparation actually started while I was doing my post-graduation, especially during the second year. When the entire country was in lockdown, we also had some amount of time during our quarantine period during the COVID times. The actual preparation with full force has started during the January this year, while I was preparing for my final year examination, university examination. And after finishing, unfortunately, it was postponed many times due to the second wave of the pandemic. And after that, the NEET and SS was announced. Again, there were multiple postponements and change in the syllabus pattern, as you know. And finally, AIIMS was the first exam after in this session to we have given it, and we are preparing for NEET also, sir.
And can you tell us how did you prepare? What are the things that you did? And was your NESS was your primary aim or NEET exam was your idea? I mean, can you tell some aspects of preparation?
Initially, my preparation strategy was to be thorough with the general surgery part regarding the course, regarding the MS course. So while studying for the general surgery MS university examination, I've already given the AIIMS exam last year, which I have secured 12th rank. I was interested more in taking in Tata Memorial Hospital, where I have not chosen to opt for AIIMS, and I continue to study thinking the NEET exam to be in November. Unfortunately, the exam also got postponed. Now, after passing out my MS examination, predominantly I started studying DeVita for oncology, and I have made some notes and also started listening to speed classes, the oncology part specifically. The general surgery class of speed I was listening from the past 1 year, and after the exam I shifted to listening even to the oncology part. It has helped me during a short span in order to revise such a large volume of data. And after finishing the AIIMS exam, I again started reading general surgery to cope up with again the NEET preparation pattern.
For the surgical oncology, what were your perspective of preparation? There were almost 50 questions, 50 and odd questions were there from surgical oncology, and almost 30 questions were from general surgery. In that, what were your predominant area of preparation that helped you to get on first 3 ranks and the 3rd rank? That your focus was on which part of onco? Was in gastro or uro? Yes. Were you predicting something and your preparation matched with that?
Yes. Actually, sir, AIIMS pattern is predominantly based on few focused areas. Especially when we compare the last year's papers, there is multiple repeated topics, and I've concentrated predominantly on those topics for preparation of AIIMS, especially the gastro part and also the thoracic oncology. There are predominantly a lot of questions which are asked on thoracic oncology, and also the both cytoreductive surgeries, HIPEC, etc., which are done predominantly in AIIMS Delhi. And there are very few areas which are not usually asked in AIIMS, such as CNS tumors, very few of head and neck tumors which are not usually asked in AIIMS. I have kept them for NEET to read them in NEET. And so predominantly I have read the thoracic part, oncology, gastro part, and from every cancer of gynecology and urology, usually we get one question each.
So how did you revise? What was your revision strategy?
So revision was the most important part in order to recollect all the things we have learned, especially in oncology where we have a lot of genes and a lot more things to remember, such as syndromes and all. One thing was to prepare a few notes of 3 to 4 pages for each chapter, so that I could have a standby during my revision. The second is while visiting the speed app and also looking back at the PPTs which have been taught previously, and sometimes even if I felt some topic I could not understand properly, then I even went to watch the videos, recorded videos.
So were the tables which were taken as a part of revision from Devita, where there was, I mean, because this time you want to do tables, were there some benefit on these tables which were done exclusively from Devita, tables and images?
Yes, sir. Devita has only a few very few tables and images. Predominantly are useful for NEET. Yes, there are many tables which are even asked in AIIMS also. And the predominant the NCCN guidelines also, which have been covered along with the tables in Devita during the revision classes especially, they have been very useful. And when the even speed was very quick in adapting all the changes during the changed pattern, and no time was wasted actually during the transition period also between different preparation patterns. So it has fetched and improved a lot of time. So the actually NCCN guidelines are also very huge to revise, and the faculty has have made it in a very simpler fashion, and picked up some important points and gave us some notes which really helped in preparations.
Okay. And how many questions did you attend?
Sir, last time actually I have attempted 76 questions out of 80 questions, and predominantly lost many marks in negative marking. So this time I have been more conservative in attempting the questions, and I have attended about 71 questions out of 80, sir.
71 out
Yes.
of 80.
Yes, sir.
Great. Now, when we are just coming to the end of the interview, I want to ask you, what do you want to tell the juniors or the aspirants of surgical onco? What you believe that this if I would have done have been a greatest advantage? Something like that you would have already prepared. So if you want to say something, so that you can say, so it will reach a lot of people.
So actually the total number of MBBS seats and MS seats have been gradually increasing the past decade. So we have more and more of people who have been passing out, and the competition is increasing every day. And it does completely, it is not just climbing the peak. We need to do a pole vault actually at this point of juncture to get across the very few number of MCH and DM seats. So the basic part is to start preparation in a very early phase while during your post graduation, along with concentrating with the wards and clinics. Predominant amount of time should also be spent in preparation. We need not only just our own self preparation, we need some extra push from behind in the form of good mentorship, good seniors who guide us, especially contemporary teachers in the on various platforms. Speed has been a very good platform in such sense, especially Dr. Basant sir and everybody who has been very keen on teaching the new, adapting to the new techniques of teaching and new questioning patterns. And actually, they're very important for a fresher who doesn't have much knowledge about how questions are asked and how questions are framed. So once we get to them, actually, we'll know how to prepare from starting itself to pick up the actual points from the text while we are reading itself, so that we save a lot of time, and instead of reading again, going back and reading again during the preparative phase, we can do it from the starting time itself. So I request everybody to start preparing in early phase, because the competition is very huge and it is increasing day by day.
Great. So I really thank you for sharing wonderful preparation tips of preparation strategies, and I wish you once again all the best and all the success as a great surgical oncologist years to come. And keep in touch, and also invite you to be a faculty team in speed to inspire many more students and to share your hard-acquired knowledge for speed.
Sure, sir. I would do.
Okay, and I also wish you a happy New Year to your family members and related friends.
Thank you, sir. I wish all the speed members the same. Thank you.